So the title of this session, as mentioned just now, is Health Optimization Frameworks. And we have Dr. Arvinder Soin, the architect of liver transplant in India, one of the prolific surgeons who looks after a great majority of live transplants that happen, which very few people do globally. So I request Dr. Arvind Soin to come up on the stage and deliver his talk.
Good afternoon, everyone. At the outset, I'd like to thank Professor Deepak Saini and Professor Suramya Asthana and the team for inviting me to talk about metabolic health, the key to longevity. I'm a liver transplant surgeon, and I'm here before you talking about metabolic health because liver is really at the core of keeping you metabolically healthy, and I'll show you how. So let's get started with the moot question. Are you in perfect metabolic health? Would somebody like to volunteer to say that they are in good metabolic health? Show of hands. Who thinks they're in perfect metabolic health? Good. Why don't you stand up and tell us what metabolic health is? No, it's a serious exchange of knowledge. I'm not making fun.
Having having a well-regulated mitochondria. Mitochondria function is slightly higher.
Okay, so what makes you say that you're in perfect metabolic health?
Because I took a couple of times red light therapy and it took a lot of antioxidants. So
red light therapy and?
Antioxidants.
Antioxidants.
Yeah, flavonoids.
Well, that's very interesting. Thank you very much for your perspective.
Thank you.
Anyone else who thinks they're in perfect metabolic health? Okay. We're not going to have any more, just two people. I know that most of you are in perfect metabolic health.
I'm not sure whether I'm in perfect metabolic health, but I can talk about what metabolic health is. Someone is in perfect metabolic health, he or she, they're able to sleep well, digest well, excrete well, and always in bliss.
That's, again, a good perspective, but you're nearer the truth than the previous gentleman. Now, it's simply optimal functioning of the body's energy management systems to efficiently process, distribute, store, and utilize energy at both the cellular and organ system levels. It's like you're a car, and the fuel is good quality. The engine, which is metabolism, is well oiled. You're taking enough proteins and you're taking enough minerals and vitamins. And you're not a reckless driver. You're looking after your body well. So all that amounts to saying that you're in good metabolic health. What does it all mean in terms of, doc, how do I know if I'm in good metabolic health? So these are the parameters that you have to look at when you're talking about metabolic health. Glucose regulation, insulin sensitivity, lipid metabolism, blood pressure, visceral adiposity, which means the fat around the internal organs like heart and liver and intestines. Body composition, you must have heard of the fact that there are machines called in-body machines in your gyms, which can tell you what your lean muscle mass is, the LMM, and the fat percentage. These are important because these drive inflammation. You've heard enough about inflammation earlier today, how that is a driver of all chronic diseases. Then liver health, for sure, is a part of metabolic health. Then inflammaging, which means aging due to inflammation. And then, of course, having a healthy gut flora or microbiome is integral to being metabolically healthy. And what should these levels be? The fasting glucose should be less than 90, HbA1c should be less than 5.6. You can take pictures because this is where you have to get, but probably won't. So the HOMA-IR, which is insulin sensitivity, has to be less than 2. AL ratio, the higher the better. That's adiponectin leptin ratio. Don't worry about what it is. Lipid metabolism, triglycerides less than 100, LDL less than 100, HDL more than 40 or 50 if you're a man or a woman, respectively. And there are other ratios that you have to look at. Blood pressure, Visceral adiposity is a very simple measure of visceral adiposity, which is waist circumference. And if you're a female, you should be less than 35 inches. And if you're a male, you should be less than 40 inches. I personally think 40 inches is a bit much, but anyway. And then, like I said, in-body measurements for getting your LMM and your fat percentage. Liver health means your enzymes, your SGOT, SGPT, or AST, ALT should be normal, and your fat percentage in the liver should be less than 5%. And then inflammation measures, David tried to tell us in the earlier session, the morning session, what to measure. But what is accepted is high sensitivity CRP and AL ratio, IL-6, TNF. The last two are kind of not always done. And then healthy microbiome. I honestly don't know. I think Anu Acharya knows what healthy microbiome is, but it has to do with good digestion, having good insulin sensitivity, and having low levels of inflammation. So now you know what metabolic health we are talking about. Now, what happens if you're not in good metabolic health? What happens is that you get metabolic syndrome, which I will remind you is the one in orange here. It's called MET-S, and it comprises of glucose, triglycerides, HDL, BP, and waist circumference. And if you have metabolic syndrome, which is more than 2 features out of the 5, then you're predisposed to having neurological disorders. In ladies, PCOS, polycystic ovary syndrome, cancer, cardiovascular disease, type 2 diabetes, stroke, and non-alcoholic steatohepatitis, which means fatty liver, which has become inflamed. Now, how is a liver specialist talking to you? Because liver is the metabolic command center, if you please. So a normally functioning liver, it does about 500 functions. Among the main functions which relate to metabolic health are that all the nutrients that we consume that go to our gut will go into the blood circulation, which first goes to the liver. So liver is the first station where all the nutrients will stop. The insulin resistance, which is the harbinger of diabetes and metabolic ill health and metabolic decline, is actually starting in the liver in 90% of the cases. And liver is responsible for internal body manufacture of lipids, for storing glucose as glycogen, for manufacturing bile acids, which are signals, both positive and negative, for metabolic health, and nutrient sensing, which means sensing the quality and quantity and the type of nutrients that we consume. What happens when liver becomes fatty and abnormal? What happens is that fatty liver is really the canary in the metabolic coal mine, which basically means it's a warning signal that the coal mine is getting too much carbon monoxide. And canaries typically need oxygen to sing. So they'll stop singing when the carbon monoxide levels would rise. And that's where this comes from. So if you have fatty liver, then you could be developing other serious chronic liver diseases, chronic diseases, not just liver, but other organs. There is a two-way relationship between liver disease and metabolic dysfunction. Liver disease reflects it as well as worsens it. And there is relationship between fatty liver progression. You look at this, normal liver going to fatty liver, and then becoming inflamed, becoming fibrosed, which means scarred. Scarring increases, there is cirrhosis. This can lead to liver failure and liver cancer. Now, this progression has to do with systemic metabolic deterioration, which means the heart disease will become worse, the neurological disease will become worse. So they're quite correlated. And then, did you know that non-alcoholic fatty liver disease independently increases the risk of cardiovascular disease by 65%, independent of all other factors? And when fatty liver gets better, then the metabolic parameters improve. And liver fibrosis, which means scarring in the liver, strongly predicts the overall death risk, again, independent of liver disease. So that's how important the liver is. Now, we've understood the gross meaning of metabolic health and the parameters that help us understand whether we're healthy or not. Now, what happens at the cellular level? What is metabolic health at the cellular level? It basically means good mitochondrial function. You were right there, right? Mitochondria. So, so, so good mitochondrial function, which means now mitochondria is basically the energy storehouse of the cell and of the organ system and of the body. And ATP is the fuel. So good mitochondrial function basically has to do with efficient energy production with minimal free oxygen radical generation. Now, free oxygen radicals are bad things. Antioxidants actually counteract the effects of those. Free oxygen radicals cause inflammation. So mitochondrial dysfunction is basically a hallmark of aging. Then at the cellular level, there is normal regulation of nutrient sensing pathways for cellular growth, DNA and cellular maintenance and repair. That's what happens when you're metabolically healthy at the cellular level. And finally, you're metabolically flexible, which means that there is easy switch between the fuel sources that you utilize, carbohydrates, fats, and ketones, as per the needs and demands. Just like in a car, which is hybrid, you could use electric power or regular petrol. The car switches between the two without you realizing it. The same way the body has to do the switch. So again, this cellular adaptability is absolutely essential for longevity. And what happens when the mitochondrial dysfunction comes in? You know that healthy mitochondria are essential for metabolic adaptation and flexibility. And with aging and with overeating, you will get less mitochondria, which are old, which are not eaten up, the debris is not cleaned up. They will have increased ROS or reactive oxygen species production, same thing which I referred to, and they will have reduced NAD to NADH ratio. And how do you fix that? Exercise is the most potent stimulus for getting the mitochondrial health back. And there are now people who push in peptides like MOTS-C and humanin, which are mitochondrial derived, and they are emerging as metabolic regulators. The problem is you don't know how much of it goes where. So really, I would suggest that don't overeat, exercise, and leave the NAD and MOTS-C peptides for future research. Now, how does this all come together? I've told you the overall picture, systemic picture, I told you the cellular picture. Now, what happens is that with lifestyle and bad diet and diabetes and metabolic dysfunction, I'll need a couple of minutes, there is inflammation. So these are all driving inflammation in the body, and that becomes chronic. And that is represented by all these cellular mechanisms which were talked about in the previous talks. And that leads to age-related diseases like metabolic diseases we've just spoken about, cardiovascular disease, neurodegenerative disorders, cancer. And that induces hallmarks of aging, or if they're already hallmarks of aging, that hastens them. And these are the hallmarks that you hear. The scientists will understand that. Now, let me point you out to these three things: stem cell exhaustion, mitochondrial dysfunction, and telomere attrition. Now, everybody wants stem cells. Everybody wants MOTS-C peptides to set their mitochondrial dysfunction right. And people want magic telomere lengthening solutions. But you tell me, if you're actually letting this entire sequence of events happen, how will these three fix anything? So these have to be in addition to lifestyle modification, is what I'm saying. Now, what does it all mean for us? Sadly, we have the dubious distinction of being first or second in all the elements of metabolic syndrome in the world. We were not there, but we've really come up, gone from fourth, third, second positions to first and second positions in all of these things. It's very sad. So brings us to the same question. How many of us are metabolically healthy? The first question was, are you in perfect metabolic health? The second question is, any guesses on how many of us are metabolically healthy? Your choices are 70, 50, 30, and 10%. 30? 10, that's really pessimistic. Anybody else? Okay, 10%, you're right. But you don't get a prize. So the thing is, India, there are no figures of this thing, but in the US, only 12% of the adults are healthy without metabolic ill health. But India, you know, is first and second in all the elements, so therefore India is worse. And we could be 8%, 10%. And the rest of us have one or more elements of MET-S or metabolic syndrome. Even though you may not have the complete metabolic syndrome, even one element of MET-S will push you at a higher risk than normal for cardiovascular disease, neurodisease, so on. The other bad news is declining metabolic health precedes diagnosis of overt disease by 10 to 15 years. So you better start testing now.
Dr. Soin,
disease?
Dr. Soin, I would love to have some question answers. So if you could expedite.
I will take 2 minutes, please. So basically, you have to diagnose them early. And the other problem is that everybody believes I'm only 20, my kid tells me I'm 25, so I don't have to worry. That's wrong. Metabolic ill health starts in young adulthood, not middle age. But there's good news because improving metabolic health at any age will improve healthy lifespan. How do you fix it? Time-restricted eating or intermittent fasting. 8 to 10-hour feeding windows are perfect. The earlier in the day you start, the better. There are scientific studies to show that they help in improving metabolic health and longevity. Exercise and muscle is an organ which has hormones like myokines, which have a positive influence on metabolic health. And your best longevity pill is a good exercise prescription. So get your exercise prescription, and that's where you will get longevity. There are some exercise mimetics, which means they act like you've done exercise. So you sit on your couch, but you consume those pills, and it's like your body behaves like you exercise, but they're not there yet. Might happen. So you are what you eat, you already know that. So Mediterranean diet helps, low carbs help, plant forward patterns, personalized nutrition, and protein intake optimization. And sleep, do you know that losing one night's sleep lowers your insulin sensitivity by 25% or raises your resistance by 25%? And what it does is it acts through ghrelin, which is the hunger hormone, and leptin, which is the satiety hormone. It changes their balance. Ghrelin increases. And if you have fragmented sleep, it's bad news. And you obviously have to fix it with sleep well therapy with a sleep neurologist. And there are some other drugs like metformin, semaglutide, the flozins, which lower your weight, lower your blood glucose, improve your diabetes, and improve your risk of cardiovascular disease and stroke. And therefore, by inference, improve longevity and health span. I'd summarize here saying that metabolic health is a modifiable determinant of health span. And you have to move beyond chronological age to metabolic age. And that is determined, I already told you, by the factors, glucose, HbA1c, lipids, etc. You have to beat the killer diseases by metabolic optimization and time-restricted eating, exercise as a longevity pill, diet, sleep, and then drugs and supplement. In that order, lifestyle first, is what you have to do. And restoring metabolic health as anti-aging strategy is basically at the core of longevity medicine. And there are some personalized metabolic optimization
Dr. Soin, we'll have some
technologies.
questions.
Now I'm going to leave those aside and have you ask me questions.
Hi, Dr. Soin. Very interesting talk. So my question is about the last slide you showed about semaglutide and metformin. You already mentioned that these would be the last resort for
didn't
an
say that.
intervention to.
I didn't say that.
So when would you prescribe this to someone? Like,
So if somebody's got diabetes, obesity, they should take it. But if somebody's got overweight, somebody's overweight by 3 kilos and they want a quick fix solution and take semaglutide, that's a bad idea. You should just do lifestyle modifications.
Any other questions?
Yeah, good afternoon, doctor. Yeah,
Yeah.
this way. Okay, top row.
Yeah.
See, doctor, the question is, see, we know we're talking about longevity here, but as a matter of fact, I read somewhere that 80% of the deaths today worldwide is accounting for metabolic issues. 80%. So if that is the case, why are we not paying so much attention on it?
You're with me, I'm asking the same question.
Yeah. I mean, we know, but that some sweets are there, maybe, post lunch or something,
Many
they're
good
so
things.
attractive.
Okay,
Yeah.
that's the last question that we have.
Yeah, any more?
Dr. Soin, you can have it over a cup of coffee subsequently.
Thank you
so much.
Thanks.